Welcome to all. Myself Sajithra, lecturer of Emmanuel Arasar College of Pharmacy. Today I am going to present about the topic anti-inflammatory drugs. Inflammation is an important protective mechanism of the body, but uncontrolled inflammation can lead to serious diseases. Anti-inflammatory drugs are widely used to control pain, swelling, fever, and tissue damages. In this session, we discuss about the mechanism of inflammation, classification of anti-inflammatory drugs, and mechanism of action of anti-inflammatory drugs, therapeutic uses, adverse effect, and recent advances in anti-inflammatory drugs. Now, move on to the introduction part. First of all, we should know about inflammation. What is inflammation? Inflammation is a protective response against harmful stimuli such as infection, injury, toxins, or irritation. The main purpose of inflammation is to eliminate the cause of cell injury and to remove the damaged cells or tissues and to initiate the tissue repair and healing. Now move on to the signs of inflammations. Redness is the main sign of inflammation. This redness is caused due to increased blood flow. And second sign is heat. This heat is caused due to vasodilation and then swelling. Swelling is caused due to fluid accumulation. Pain. Pain is caused due to chemical mediators. And finally, loss of function. This loss of function is caused due to tissue damages. Importance of inflammation. Inflammation protects the body from infections, removes harmful agents, promote tissue healing, etc. Example for this inflammation is asthma, inflammatory bowel disease, etc. Then move on to the types of inflammation. Inflammation is classified into two main types, that is, acute inflammation and chronic inflammation. Features of acute inflammation is rapid onset of action and the acute inflammation is short duration of action. Mainly it involves neutrophils. Then characteristics of this acute inflammation is redness, heat, swelling, pain, etc. Example for this acute inflammation is injury, bacterial infections, etc. Then second classification is chronic inflammation. Features of chronic inflammation is long duration of action and the tissue destruction may occur. Macrophages are involved in this chronic inflammation. Causes of chronic inflammation is infections, autoimmune disease, and long-term exposure to irritants. Example for chronic inflammation is tuberculosis, chronic asthma. Then difference between acute and chronic inflammation is acute inflammation is rapid onset of action, but chronic inflammation is slow onset of action. Acute inflammation is short duration of action, but chronic inflammation is long duration of action. And acute inflammation is neutrophils dominant, but chronic inflammation is macrophages dominant. And then move on to the next slide, which is causes of inflammation. Inflammation are caused by various factors such as microbial infection and physical injuries such as burns and radiations, chemical irritants such as acid, toxins, pollutants, etc. Immune reactions such as allergy, autoimmune disorders, etc. And then tissue necrosis, which means cell death due to injury. These are the major causes of inflammation. Then, mechanism of inflammation. Inflammation have various mechanisms such as tissue injuries. Tissue injuries may be caused due to cells are damaged due to infections, and then release of chemical mediators. Chemical mediators such as histamine, prostaglandins, cytokines, which causes inflammations, and then vasodilation. This vasodilation is caused leads to increased blood flow and redness and heat, increased vascular permeability, and then phagocytosis, and finally tissue repair. These are the major mechanism of inflammation. Then chemical mediators of inflammation. This chemical mediators of inflammation is classified into two main mediators. First one, cell derivative mediators and plasma derivative mediators. Histamine, serotonin, prostaglandin, leukotrienes, cytokinins, nitric acid are cell derivative mediators. This histamine is released from mast cells, and this histamine causes vasodilation. Serotonin increases the vascular permeability. Prostaglandin causes pain and fever. Leukotrienes causes bronchoconstrictions. Cytokinins causes activate the immune response and increases the inflammation. Example for cytokinin is TNF alpha, etc. And then plasma derivative mediators. Complement system. This complement system destroy the microorganisms, and then bradykinin. This bradykinin causes pain, vasodilation, etc. And finally, coagulation factors. This coagulation factors help in clot formation. This clot formation which leads to inflammation. And then move on to the anti-inflammatory drugs. First of all, anti-inflammatory drugs are the agents that reduce inflammation by inhibiting the production or action of inflammatory mediators such as prostaglandins, leukotrienes, cytokinins, and histamines. The main effect of anti-inflammatory drugs are which reduce the pain, decrease the swelling, and reduce the fever and improve tissue functions. Common indications of this anti-inflammatory drugs are musculoskeletal disorders, allergic conditions, autoimmune disease, asthma, muscle pain, fever, etc. And now move on to the mechanism of inflammation. This mechanism of inflammation is inflammatory pathway. First of all, inflammatory pathway are divided into two main pathways, which is Cox pathway and Locke's pathway. First of all, cell membrane in phospholipids release arachnoic acid by phospholipase A2 enzymes. This arachnoic acid is metabolized by two pathways, that is Cox pathway and Locke's pathway. Cox pathway means cyclooxygenase pathway. This cyclooxygenase pathway which produces prostaglandins and thromboxanes. The function of this pathway is to produce pain, fever, inflammation, etc. And the second pathway is Locke's pathway, which is lipooxygenase pathway. This lipooxygenase pathway which produce leukotrienes. The function of leukotriene is bronchoconstriction, etc. These mediators produce pain, fever, vasodilation, and edema. And then classification of anti-inflammatory drugs. The anti-inflammatory drugs are mainly classified into two types, that is non-steroidal anti-inflammatory drugs and corticosteroids. These non-steroidal anti-inflammatory drugs are classified into many types such as selective COX-2 inhibitors, non-selective COX-2 inhibitors, etc. And this corticosteroids blocks the phospholipase A2 enzyme. and non-steroidal anti-inflammatory drugs which blocks the COX enzymes. First, we see about the non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs that possess anti-inflammatory action, analgesic action, and antipyretic action. Mechanism of action of non-steroidal anti-inflammatory drugs are which inhibit the COX enzyme, which means it inhibits both COX-1 and COX-2 enzymes, which reduces the prostaglandin synthesis. It leads to reduced reduction in the pain, reduction in the swelling, and reduction in the fever. And then corticosteroids. Corticosteroids reduce the phospholipase A2 and suppress the cytokinin production and decrease the migration of inflammatory cells. And the example for this non-steroidal anti-inflammatory drugs is aspirin, salicylic acid, etc. And example for these corticosteroids are prednisolone, etc. The main adverse effect of this non-steroidal anti-inflammatory drug is it, it produces gastric irritation, renal toxicity, and platelet inhibition. Advantages of this non-steroidal anti-inflammatory drugs are it is effective for pain, inflammation, and non-hormonal drugs. Main example for this non-steroidal anti-inflammatory drugs are aspirin, ibuprofen, diclofenac, etc. Corticosteroid. The mechanism of action of corticosteroid is inhibition of phospholipase A2 enzyme and suppress the inflammatory gene transcription. Example for this corticosteroids are prednisolone, hydrocorticosterone, etc. Uses for this corticosteroids are it, it reduces the severe inflammation and it is used in the asthmatic conditions and it is used for autoimmune disease, etc. Therapeutic uses of anti-inflammatory drugs are it reduces the joint inflammation and it relieves the pain and stiffness in the joint, reduce the body temperature, that means it acts as a antipyretic action, and then it reduces the back pains and it reduces the pain which are caused by tissue injury and it reduces the inflammation during acute attack, etc. And these anti-inflammatory drugs are used in the conditions such as asthma, gout, etc. And then move on to the adverse effect of non-steroidal anti-inflammatory drugs. This non-steroidal anti-inflammatory drugs cause various gastrointestinal effects such as gastrointestinal bleeding, peptic ulcer, etc. These are caused due to loss of protective prostaglandin, and then it causes renal effects such as kidney damage, sodium retention, etc. And this non-steroidal anti-inflammatory drug cause respiratory effects such as bronchospasm. This bronchospasm is most commonly seen in the administration of aspirin drugs. And then see about the adverse effect which are caused due to corticosteroids. These corticosteroids will create a hypertension, weight gain, mood changes, increased infection risk, etc. Contraindication. First of all, we see about the contraindication of non-steroidal anti-inflammatory drugs are peptic ulcer disease, severe renal impairment, and bleeding disorders, etc. Corticosteroids. Contraindication of corticosteroids are systematic fungal infection, uncontrolled diabetes, severe hypertension, etc. And recent advances in these anti-inflammatory drugs are biologic anti-inflammatory agents and targeted cytokine inhibitors, improved COX-2 selective inhibitors, and drug localized drug delivery system, etc. Conclusion of anti-inflammatory drugs is anti-inflammatory drugs are essential for treating a wide range of inflammatory disorders. Non-steroidal anti-inflammatory drugs are useful for mild to moderate infections, and corticosteroids are powerful drugs for severe inflammation. Proper drug selection minimizes toxicity and improves therapeutic outcomes. And the recent advances provide safer and targeted therapies. These, these are the importance of anti-inflammatory drugs and the usage of anti-inflammatory drugs. Thank you for listening.